Deposits of crystal buildup in joints, tendons, and even muscle tissue. Sometimes pain attacks can happen, causing severe pain, swelling, redness, and tenderness. This usually occurs in the joint of the big toe, otherwise known as podagra, but can also occur in ankles, knees, hands, wrists, and elbows. It gets worse with stress and eating things like shellfish and anchovies. Stay tuned to learn more about this condition, the treatment options, and ways to prevent it.
Welcome to Region Med 101 podcast with Dr. Yu. Learn about all things medicine, health, and wellness. We hope you enjoy listening. Please show your support by subscribing and follow our podcast.
Gout. Gout is a disease that can occur acutely or immediately, or become chronic and lifelong issues due to problems with purine metabolism that leads to deposits of urate crystals in the joints, tendons, and muscle tissues. Classically, the first big toe joint, otherwise known as podagra, can cause pain in the first big toe. But again, gout can occur in literally every small joint in the body, as well as the knees. Patients being obese, having a metabolic syndrome, having type 2 diabetes, high blood pressure, and chronic kidney disease can increase the production in gout because these conditions cause what's called hyperuricemia. A condition called second arthritis can occur due to buildup of crystal deposits called CPPD, otherwise known as calcium pyrophosphate deposition. This is called pseudogout. CPPD crystals can deposit on joint cartilage and even ligaments, the tissue that connects bone to bone. Please note that CPPD or pseudogout is very different from gout. Physicians should always consider other diseases that are not gout or pseudogout for pain syndromes like severe foot pain. Diseases like critical illness ischemia, acute compartment syndrome, herpes zoster infection, metatarsal stress fractures, or other rheumatoid arthritis and diseases like osteoarthritis should be ruled out. Diagnosis of CPPD disease is done by X-ray, showing linear or stippled calcification of the articular cartilage of the joint. Also note, an unrelated hydroxyapatite calcification can occur in the rotator cuff and shoulder tendons. Ultrasound can also detect chondrocalcinosis. Joint fluid aspiration under a polarizing microscope can confirm gout versus pseudogout. Gout is confirmed by the negatively birefringent urate crystals from synovial fluid with a polarizing microscope. Positively birefringent rhomboid-shaped calcium pyrophosphate crystals or urate crystals make pseudogout more likely. WBCs can be extremely high, leading to treatment for septic joint disease. Physicians should also note that finding osteoarthritis at the MCP or metacarpal phalangeal joint, this should prompt underlying etiology such as secondary CPPD due to hemochromatosis or hyperparathyroidism. Chondrocalcinosis is a term found on X-ray reports that are not always synonymous to CPPD crystals or pseudogout. One severe but rare presentation of CPPD disease is called the Crown-Dens syndrome, affecting the upper part of the cervical neck, usually diagnosed with X-ray and elevated CRP. CT scans should be done to visualize the calcific deposits around the odontoid process, dens of the axis. Treatment options. First, preventing the disease is most important. Gout being a purine metabolism issue, certain restrictions and limitations in your diet will help reduce your chances of having gout attacks. Limiting shellfish, such as shrimp and lobster, as well as anchovies, sardines, liver, kidney, as these are high in purine and can exacerbate gout. Also, limiting alcohol and red meats can reduce gout symptoms. Patients should know that treatment options differ dramatically if gout is acute versus chronic. In acute gout or new onset, medications like colchicine and other mild NSAIDs like indomethacin may be prescribed to reduce uric acid and inflammation of the joint. Other NSAIDs like diclofenac, ibuprofen, naproxen, nabumetone can also be used. Sometimes oral prednisone can be given. Sometimes a medication may be given to lower serum urate levels. Allopurinol, a xanthine oxidase inhibitor, may be given. Other neuromedications like febuxostat can also be given. However, liver function tests should be checked regularly. Unfortunately, patients and physicians should know that there is no proven medication that will remove CPPD crystals deposits from the joint. The goal for most medication is to slow the deposits as much as possible. If you've been diagnosed with gout, having the understanding of your disease and knowing what you're eating and drinking is important. Food and drinks that often trigger gout attacks include red meat, sugary sodas, alcohol, beer, some fish and seafoods including trout, herring, mackerel, tuna, haddock, scallops, crab, shrimp, and anchovies. Overall, gout is painful, but making sure you have the right diagnosis is important. Seeing your licensed physician is important in the management of gout or pseudogout. That concludes our podcast on gout and pseudogout. Thank you all for listening. Until the next episode. Knowledge is power, and it is the first step in knowing your condition, disease, or injury.
If you enjoyed listening to our podcast, please visit our Instagram, Twitter, and Facebook. For more detailed information, please visit our website at regionmed101.com.
This podcast is made for the general education to the public and is not intended to substitute for or provide medical advice. All information, content, and material from Dr. Yu and his guests on Region Med 101 is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician. Please see podcast and page content for full disclaimer. If you have a medical emergency, call your doctor or 911 immediately.